Good morning. I'm Gary Newton, President and CEO of Sinai Health. As we gather today at Mount Sinai Hospital, I would like to acknowledge the land on which it operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. This meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. On behalf of the entire Sinai Health team, I'm pleased to welcome the Honourable Sylvia Jones, Deputy Minister, Deputy Premier, and Minister of Health to Mount Sinai Hospital. We are honoured to host Minister Jones in recognition of the completion of Renew Sinai Phase 3A, the largest and most ambitious redevelopment in Mount Sinai's history. Mount Sinai Hospital is 101 years old, and we moved into this hospital building in 1973. With this redevelopment, we are now the most modern, state-of-the-art, 51-year-old hospital in the province. Our hospital has been transformed with new and expanded services, including a new emergency department, a new critical care unit, new operating rooms, a new cancer program, and new inpatient and ambulatory facilities. This work was all completed while running our hospital and against the backdrop of the COVID-19 pandemic. We thank Minister Jones and the Government of Ontario for investing in existing hospital infrastructure. The investment in Mount Sinai Hospital has provided the province with a new and expanded hospital that serves the people of Ontario and through specialized programs serves all Ontarians. The expansion and modernization of Mount Sinai Hospital also provides great value to Ontario by adding much-needed hospital capacity in a very cost-effective manner. Partnership plays a central role in any successful redevelopment project. I would like to thank our partners, Infrastructure Ontario, Stantec, and Ellis Don for their support and efforts towards achieving the successful completion of Renew Sinai Phase 3A. Please join me in welcoming Minister Jones to the podium.
Thank you so much, Dr. Newton, and good morning, everyone. It is indeed great to be here today to celebrate the completion of the largest redevelopment in Mount Sinai's hospital history that will ensure families in Toronto and across Ontario can connect to the right care in the right place now and for decades to come. On behalf of Premier Ford and our entire government, I want to thank the team here at Mount Sinai for everything you do to provide exceptional, world-class patient care. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our Your Health plan, we are taking bold action and making innovative changes to build a healthcare system that lasts, a system that makes it easier for you and your family to connect to more convenient care at every stage of life closer to home. Our government is shortening wait times for key services, achieving some of the lowest wait times in Canada for surgeries and procedures. And it doesn't happen without growing our highly skilled healthcare workforce, adding a record 17,000 new nurses and 2,500 new physicians last year alone, while expanding medical schools, nurse practitioner, and nursing education programs, connecting hundreds of thousands of more Ontarians to primary care, ensuring you and your family can access the care you need when you need it in a setting that is most convenient, whether that is in your community pharmacy, with your primary care provider, or, in fact, your local hospital. Here at Mount Sinai, our government has invested over $383 million to renovate over 323,000 square feet, to modernize and expand the hospital's infrastructure, to improve care for patients undergoing life-saving surgery, requiring emergency care, and those with cancer. These renovated and new spaces include expanded and redesigned facilities, such as the emergency department, ambulatory oncology programs, and operating rooms with the addition of 2 new ORs. Our investment has also expanded the intensive care unit and medical and surgical inpatient areas, adding a total of 63 new beds. Gary, you have essentially built a new hospital within an existing hospital. Today's milestone is part of over 50 hospital projects our government is getting shovels in the ground for that will add over 3,000 new beds over the next 10 years. Our government is also continuing to support our hospital sector by investing more than $228 million this year, an increase of 10% over the previous year, to support critical infrastructure upgrades and repairs at 129 hospitals and 58 community healthcare facilities across Ontario. And through our most recent budget, our government is increasing total base hospital funding by 4%, an unprecedented increase for the second year in a row, ensuring no matter where you live, you can connect to the care you need close to home. Investing in the largest redevelopment of Mount Sinai in the hospital's history is another way our government is continuing to address the needs of Ontario's growing communities, building a healthcare system to last. Thank you again to the incredible team at Mount Sinai for hosting us today and for the exceptional care you provide to families each and every day. You know it makes a difference. Thank you, and stay well.
Thank you. We'll now be taking questions from the media. If media present could kindly form a line behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Hi, Minister. Barbara with Queen's Park Briefing. I wanted to ask you about wastewater surveillance initiative. So the province ended the program this week. This is 2 months before its current budget runs out. So why is that? Why is the province abandoning a public health strategy that is so successful and that the government itself helped to pioneer?
So I want to be very clear that the COVID wastewater testing will continue in the province of Ontario. We had a system that utilized a number of different partners. We are now going back to the pre-existing program where the federal government will continue to monitor wastewater as for a number of things, but COVID included. And the federal government has also working with the Environment, Conservation and Parks Ministry to actually choose 4 additional sites in Ontario. So I want to be clear, the duplicative piece has been removed. The federal government will continue to test wastewater in the province of Ontario, and we have a commitment that they will expand.
So, but the province has been doing weekly wastewater testing in 7 regions, including the GTA. So how frequently does the federal government intend to test the water, and at how many locations? Will it be the same?
So what I can tell you is I know that the existing federal program will stay in place to test for COVID in our wastewater. Specifics as to how many times, I'm sorry, you'd have to follow up with the Ministry of Environment, Conservation and Parks.
Hi, Minister. Jack Howan from the Trillium. I wanted to ask you about the pharmacy expansion. Some pharmacists online are saying that they're excited about the new powers or potential powers, but they're under immense corporate pressure, especially the ones that work at big chains. We know from previous investigations that mistakes can happen because of corporate pressure. Is now the right time, in your opinion, to be expanding these powers?
So when we made an expansion of scope of practice for a number of clinicians, including pharmacies, we've also done expanded scope of practice for midwives, for nurse practitioners, and for RNs. The scope of practice for pharmacies in particular, allowing them to assess and treat for symptoms of 19 minor ailments, has meant that over 1 million people have accessed that service. 1 million people who didn't have to stay home from work because they had a UTI. 1 million people who didn't have to go into an emergency department or book an appointment with their primary care practitioner because they had pink eye or a cold sore. It is clear that that convenience and that opportunity to use a skill set of a regulatory healthcare professional that has a regulatory college oversight is something that the people of Ontario have embraced. And the consultations that we've just started are a conversation that we will have with not only clinicians, pharmacists, primary care practitioners, RNs, but the general public on where we can continue to see expanded scope of practice for a number of clinicians, including pharmacies.
Well, I was hoping you would address the pharmacist concerns, but switching gears, I wanted to get your thoughts on involuntary treatment for drug addicts. This is something Pierre Poilievre hasn't ruled out, and I was hoping to get your thoughts.
So what we see right now is a system that, frankly, is not helping the people most in need. I am greatly concerned that we have more people who don't have access to treatment and who are not taking advantage of the treatment facilities that are available. You know, our government has expanded treatment beds by over 500 in the province of Ontario. We need to make sure that people understand where those treatment options are available and to continue to offer them. And the Premier, the Associate Minister of Mental Health and Addictions, and myself are working very closely on some new initiatives that you will see coming out in the weeks to come. And for me, it's very much how do we drive and make sure that people, when they're ready, get the treatment that they need.
Hi, Minister Tina Yazdani with City News. I just want to go back to the wastewater testing because, we've been told that the federal program is inadequate, not just because of fewer sampling locations, but also not the scope that we have now. This was an innovative program that was developed here in Ontario, and I'm wondering why the government has chosen not to invest the $10 million to continue it.
So again, I want to be very clear. The wastewater testing will continue in the province of Ontario. It was augmented and increased by the province during the COVID, height of the COVID pandemic. It was very specific for COVID testing. We have returned to what has been in place in Ontario for decades, and that is a federal government that assesses the wastewater and works with our public health units and with our clinicians to make sure that as that information comes in, it is disseminated to public health units across Ontario. We had an increase during the height of the pandemic because of the need for additional COVID wastewater testing, and we are returning to what I would call a normal state of affairs and making sure that the federal government not only continues the wastewater testing, but also expands it to 4 additional sites, and we have that commitment now.
Okay, and since the Pharmacist Powers announcement, the Ontario Medical Association's president has come out pretty strongly to say this government has failed to adequately fund primary care. What is your response to that?
Well, I don't think it's an either or. You know, we made an announcement in February of 78 new primary care multidisciplinary teams in the province of Ontario. We already have seen some of those teams hire up and have started taking on patients in communities across Ontario. To me, it is making sure that all of our highly skilled and highly trained clinicians have the opportunity to train at their highest level. I've said this before, I will say it again, Ontario was behind when it came to scope of practice for pharmacists in particular. There were many Canadian jurisdictions that had already adapted and used this model. And we will continue to work with all of our regulated health professionals to see where the scope of practice increases that we can do to look after the patient and make sure that they have access. And that's what we've done. And again, I will say, with midwives, with registered nurses, with practical nurses, with pharmacists, we're making sure that all of these regulatory colleges and highly skilled clinicians have the opportunity to practice at their highest level. And we've seen excellent results. You know, I was speaking to a midwife last month, and she was very appreciative of the scope of practice changes because it meant as she was continuing to work with that family, she could now administer some of those childhood vaccines that previously she was not able to. So those are examples of how we're making sure that all scope of practice changes are first and foremost for patient improvement and patient access.
Hi, Minister Jones. Lauren O'Neill from Global News Radio. I'd just like to go back to the addiction and opioid crisis for a moment. Several Ontario mayors have spoken out in recent days about a reported uptick in open-air drug use, so people using narcotics on the streets and public spaces. We spoke to the mayors of Oshawa, Belleville, and Guelph, and they all say that they need more help from the government to address this problem. Is this something that you're aware of, and is there anything that Ontario is doing or planning to do to address these reports of open-air drug use?
Yes, yes, and yes. I don't think that there's any doubt that many of us are very concerned when we see drug use increase in public spaces in areas that, frankly, make us as parents and leaders concerned, whether that is in playgrounds, in schoolyards. We have to make sure that we continue to expand access to treatment. As I said, we've done that, an additional 500 treatment beds in the province of Ontario. Youth wellness hubs that didn't exist less than 10 years ago are now operating in communities where young people who are concerned, who have questions, have the opportunity to get that early intervention and, frankly, treatment when appropriate. We're going to work fully with our municipal partners to make sure that we are operating and ensuring treatment for people who want and need that treatment in our communities.
And yeah, my follow-up, have you noticed, you said there are 500 more beds for treatment. Have you noticed more people going into treatment since these investments have been made? Has there been an uptick in that?
Oh, absolutely. So what we're seeing is when you offer treatment, when you offer alternatives, people, when they are ready, take those opportunities. And as I said, Youth Wellness Hubs is a perfect example of something that we didn't have 10 years ago, and we are now operating in the province of Ontario. The most recent one we opened was in Brampton. That critical age of sort of 14 into early 20s, where they might be experimenting, they might be having questions, we want to intervene and offer assistance, support, and ultimately treatment. Thanks.
Hi, Minister Jones. Siobhan Morris from CTV. I understand you're saying that you don't believe that the current approach is doing enough to help people with addiction issues, but I didn't hear a concrete answer whether you're comfortable with, as Minister of Health, with involuntary treatment, as Pierre Poilievre has suggested he's open to.
You know, I think that there are a lot of conversations that are being had about what is the most appropriate. We know whether it is related to mental health or our general physical health, that people have to be engaged in their treatment pathway. They are, in fact, part of the solution as we not only offer treatment, but get that steady state to ensure that they stay healthy. And that is, frankly, a little bit of your own input and your own involvement in keeping yourself healthy. I have concerns that involuntary treatment would not lead to the outcomes that we want. But having said that, when we see the opportunity and the need for intervention and people are willing to take on those treatments, that's when we can truly make a difference. That's when we can show them that our government is committed with an additional 500 treatment beds and other access to treatments that are not always as highly interventionist.
You had promised back in the spring new accountability measures for existing harm reduction sites. Are those now going to be bundled into this new suite of measures you say are coming, or is that approach kind of off the table at the moment?
So I think it's fair to say that it will be part of a larger government approach, all of government approach. So part of it will absolutely be additional measures to ensure staff and patient safety, but also what are the other options to make sure that we are not just focused on one aspect, and we make sure that treatment is a very large portion of the announcements that we're going to be making in the weeks ahead.
This will be the last question.
Hi, Minister. Just following up on the pharmacy stuff. So last week after your news conference, Justin Bates from the Pharmacy Association was saying that they would like to see Ontario go to a model like Alberta's, where pharmacists have much wider prescribing powers. Apparently they can prescribe anything except like pain-killing narcotics, controlled substances, that type of thing. So do you see Ontario going on a path to that, or do you think that's going too far?
I see Ontario continuing to have conversations with all of our regulated health professionals on where they see scope of practice increases. And each and every one of those will be assessed based on how does it improve the patient access and the patient outcome. I know that we have work to do that we can continue doing with other regulated health professionals. Yes, we will continue to have conversations with pharmacists, but I don't want this conversation to only be thinking we are looking at pharmacy only. It is all regulated health professionals.
Yeah, I was just asking about pharmacy specifically because of that case. The OMA has raised concerns that they think that prescribing powers and diagnosing powers could go for pharmacists could go too far, given that they have much different and in some ways a lot less training than an MD does. So your thoughts on that?
So again, part of the consultation is to get that feedback directly and to make the assessments. Regulated health professionals all have colleges. They all have responsibilities to ensure patient access, patient outcome is safe. So to suggest that one regulatory college is more focused on patient care than another, I think, frankly, is a little disingenuous.
All right, thank you. That concludes our media availability. Thank you, everyone, for coming.